Hypertension. Yeah, that guy, he's very guilty. Hypertension has known to be a risk factor for heart diseases, liver problems, kidney problems. In fact, almost every illness has hypertension in their group. And the worst part is, it seems once you're diagnosed with hypertension, then you have to like be on constant medications. Seems like there's no cure. Well, it's not our fault. But I also know that it's not easy to take medications every single day for the rest of your life. But do we even know why we take those drugs? You see, the heart pumps blood at a range of pressures. And at that pressure, it's not very difficult for the heart to pump blood. It can easily just squeeze and then get blood out to the rest of the body. Now, we need to understand that the heart is made up almost entirely of muscles. And so just like a bodybuilder, when you work out for a while, for weeks, for months, you start developing muscles. It's the same with the heart. And when the heart has worked too hard because your blood pressure is now too high, slowly that muscle starts developing, starts getting bigger. Now, for the bodybuilder, that's good. But for the heart, it's a problem because easily the heart could have squeezed and then gets blood out. But when your blood pressure is increased, it becomes very difficult for the heart to continue that way. And so the heart has to suffer now. And as the muscle suffers, the muscle develops. And so the heart becomes enlarged and becomes this way. And so it makes it difficult for the heart to be able to squeeze and get blood to other parts of the body. This is what we doctors refer to as heart failure. Is an inability of the heart to meet up with the demands of the rest of the body. And that's heart failure. And that's when you now start seeing this, legs and all that. And so when you go to the hospital, the doctor would want to bring that pressure back to normal so that the heart doesn't suffer. Because when the heart suffers for very long, it leads to heart failure or other diseases. So that's why those drugs are given to you through different mechanisms. Those drugs reduce and bring the the blood pressure back to normal. But they're very stressful. You have to take them every day because there's no permanent drug for it and there's no cure. So mommy, daddy, I know it's difficult. I know it's not easy to, be on those medications every day. But you should talk to your doctor. There could be some compromises on how often you can take the drugs. The main thing is you need those drugs so that it doesn't develop into heart failure. Till next time, this is your favorite doctor.